The last ultrasound visit that I had with her, I remember seeing her little body on the monitor, and she was sucking her thumb and she was just kind of wiggling, and the water was literally just sitting on her head. And like at that moment, I felt like I knew what was gonna happen. The week before Christmas, I started having contractions, and I went to the hospital and they put me on the monitor. But they didn't want to hospitalize me because I was not to that viability age yet. We're just gonna have to see what's gonna happen. We're just gonna have to. And I was just like, what are we waiting for? Like, we clearly know what's coming. We know what's gonna happen. Can we at least just get me somewhere so that she can have a chance? So that I can have a chance to be her mama. And I remember putting my hand on my stomach, and I was like, baby girl, you gotta hang on. Just please hang on. It felt like a life like being pulled, like I could feel like a pull away from me. And I remember crying myself to sleep. And that next morning when I got up, I remember telling my grandma, and I was like, something just does not feel right. It just feels like something's there. And my daughter's head's out when I go to the bathroom. I screamed for my grandma and my mom. My mom was like, she got down, she looked at me, and she said, you gotta push her out. And I was just like, okay. And she was like, just look at me, just focus on me, and just push. And so I did. And she came out, and my mom got her up and wrapped her in a little towel for me. And I remember just looking at her, and she was the prettiest little, she was beautiful. And she just looked like she was sleeping. And I remember holding her all the way to the hospital. And I remember I started to kind of go in and out, just kind of lightheaded, dizzy, kind of in and out. And I remember the funeral home director, and I remember him taking Amani. And that was the most cold feeling, was to see him walk away with my baby. And I remember my body just everything kind of stopped and slowed down. The doctor came in and he said, we got to get that placenta out. And I'm like, okay. So he just lightly massaged my belly, and it came out. It was intact. I think the heartbreaking part was that my placenta was perfect. There was nothing wrong with it. And it's just, I don't even have the words, because I'm like, my baby suffered, and I was begging for help, begging them to help me. And it was just like, they didn't care.
What we see in the state of Arkansas is a maternal health care crisis. And I often say that every single person that touches maternal health care is responsible for the crisis that we are in. There's no entity, no skill set, no service, no profession that can say, well, we're doing all that we can. Actually, we're not doing all that we can, because women are still dying. And if they're not dying, they're having morbidities, right? Near-death experiences. Some of the things that are happening to these women, big picture, they're not being heard. They're not being listened to. What they're saying is being dismissed. Pains are being dismissed. Aches are being dismissed. Those are just some of the instances that, women are dealing with. Just a little scratch of the surface. And it's a lot, and it's a heavy burden for those moms.
We've had women who've had birth experiences that were horrible. And we even have a few women that don't even want to talk about their birth experiences because they felt like they were close to death in some instances and weren't really treated with the respect that they feel like they were accorded to or deserve.
In my 7th month, I had a horrific experience in the emergency room. I was telling the doctor at the emergency room that it had to be my kidneys, and the pain was so intense, and all he cared about was making sure I wasn't in labor. It's hard to explain the toll that it took on me because so much of it showed up afterwards in, my health just deteriorated a lot. And that includes, I lost a lot of teeth because of, that's what happens when you have a baby. If you don't have enough nutrients, it comes from your bones, it comes from your teeth. And there's a lot of stuff. My mental health is really hard to describe because I was neglected. And I was ill and too weak to care for myself, basic care. I was vomiting 4 times a day. And that's just from water. I don't know how I survived any of it, but I was left alone on my own almost all the time, day, sometimes at night. And I just kind of mentally checked out. I got to the point where I was only trying to keep myself alive because I had a baby. And it would have been a relief to die. I can't describe the sheer misery and loneliness and feeling of utter abandonment. And that feeling has never really gone away. It passes and I don't think about it, and yet it still affects me.
I think my friend at Ujima Maternity Network said it best once when she talked about hot trash on the side of the road, where women don't feel like they're respected, that they're treated with kindness, or even that their voice matters when they are getting support in our healthcare system.
This is a national crisis. Maternal rates, not just in Arkansas, but across the country, are increasing. You can't just turn a blind eye to it. You can't turn your back to it. Everybody has to work together.